All right, it's Dr. Lisa L. Campbell. We are back with our week 4 lecture for Introduction to CPT Coding. This is chapter 8. This is part 4 of 5. Let's get it going. So, this is the cardiovascular system, and it's the same old, same old. You're going to be presented with key terms, abbreviations, common procedures, guidelines, and then the end result is that you can select the codes. I would have to say that this is probably one of the most challenging chapters from a coding perspective because of the anatomy, really, right? So the cardiovascular system is designed to pump blood throughout the body via the heart and blood vessels. There is an exchange of oxygen and nutrients that's carried through the body by the blood. And what happens is the waste products leave the body. The heart is a large muscle that acts like a pump, moving blood through the arteries and the veins. It is considered to be the major organ of the cardiovascular system, and anatomically, it is located between the lungs in the thoracic cavity. There is a nice picture in our textbook. And the heart itself is enclosed in a pericardium or pericardial sac, which is a double wall sac composed of membranous tissue that surrounds the heart. The pericardium or pericardial sac, you will see, has other components. Those components are covered in the textbook. All right, the heart itself is divided into 4 chambers. The upper chambers are called the atria. They receive blood from the veins. The 2 lower chambers, called ventricles, send blood to the arteries. So, from a flow perspective, blood enters the right atrium through the superior vena cava, and which is from the upper part of the body, and through the inferior vena cava, which is the lower part of the body. And then the blood leaves the heart through the aorta and the pulmonary artery. And then the heart pumps in a rhythm. And the rhythm of the pumping job of the cells that generate and conduct the electrical impulses. Oh, I already talked about that. All right, so abbreviations, these are common abbreviations that you can see for the cardiovascular system. All right, here we go. Let's talk about coding. So, at the very beginning of the cardiovascular subsection, there are notes upon notes upon notes upon notes. One of those notes is regarding selective vascular catheterization. That's just one of many. All right. So, first up, we have codes for pericardium, cardiac tumor, and transmyocardial revascularization. This is the first major section, and it's related to the pericardium. And just like the other areas, you saw that synthesis procedure. There is a pericardiocentesis in this particular area as well. Next up, you have procedures for pacemaker or pacing cardioverter defibrillator. And these codes do have some out of sequence situation. And a pacemaker is designed to correct and manage heart arrhythmias. So basically, the natural pacemaker of the heart, the SA node, stops functioning properly. And so the pacemaker keeps the pace of the heart. So the pacemaker is made up of a pulse generator, which contains a battery as its source of power. And these batteries last about 6 to 10 years before they need to be replaced. So they don't last forever. And the generator controls the heart rate, the energy output, and the pacing modes. So the pacemaker has a generator, also known as a battery, but it also has electrodes. And electrodes are inserted into the heart through the subclavian vein and are advanced to the right ventricular apex. And if a second electrode or lead is needed, it is fixed in the right atrial appendage. These electrodes are then attached to the battery, kind of like when you need to get a jump for your car. Same concept. The pulse generator is implanted internally under the skin, and it can be permanently or temporarily attached externally. And the pacemaker is placed in what is known as a pocket. Okay, pacemakers, excuse me, can be single chamber or dual chamber. We also have in this area a pacing cardioverter defibrillator. It's different than a pacemaker in that it sends defibrillating shocks that stimulate the heart and treat ventricular fibrillation or ventricular tachycardia. There is a really cool chart that is available in the CPT manual. You definitely want to spend some time looking at these codes because they got a whole lot of stuff going on. All right, next up, we have the phrenic nerve stimulation. In the CPT manual, there is a full description of the codes and notes that appear. And in those notes, it talks about that the insertion of a phrenic nerve stimulation device includes vessel catheterization, imaging guidance, and the initial analysis of the pulse generator with a diagnostic mode activation when it is performed. So you really want to note the additional services that are included with these codes, which basically means you would not code them separately. All right, next up we have electrophysiology. Now, it should be noted that there are electrophysiology codes in the medicine section as well. Here, we're talking about electrophysiologic operative procedures. Okay. These codes are procedures that are completed to treat dysrhythmias surgically. So remember the surgical part, right? So during these procedures, the tissue ablation, disruption, and reconstruction occurs. In this particular code family, you're going to see the words limited and extensive. And in the CPT manual, you see the description of the difference between limited and extensive. And I think at the end of the day, what you need to remember is that in order to code these services properly, you got to know the rules. All right, next up, we have the subcutaneous cardiac rhythm monitor. These monitors are also known as cardiac event recorders or implantable or insertable loop recorders. And basically, what happens is the physician inserts an event recorder at the subcutaneous layer. And the recorder basically keeps a record of the heart's electrical activity. So you have codes for the insertion, including reprogramming. And then you have a code for the removal of that device. I did want to call out that in some code families, you have a code for the insertion, you have a code for the removal. And in other code families, the insertion and the removal are included in the um, um, included in the code itself, so you can't report it separately. All right, implantable hemodynamic monitors. So, as stated in the actual code description, the monitor is this wireless pulmonary artery pressure sensor that's implanted for long term hemodynamic monitoring. This code includes a bunch of stuff. So, the deployment and calibration of the sensor, right heart cath, radiological supervision and interpretation, and pulmonary artery angiography when performed. So, that when performed is something that we have not seen too much. And so, I want to just clarify that all this stuff is included when performed. If all of it is not done, the code is still the same. So, when it's performed and when it's not performed. All right. So, I already talked about that the sensor is this device, and the data from these devices is used to manage patients who have heart failure. All right, on to the heart and great vessels. And here you see codes for exploring the heart, repairing a cardiac wound. You also see codes for insertion of grafts. And a lot of these codes are differentiated based upon if there was bypass, there wasn't bypass, and with and without a shunt. All right. Next up, we have procedures that are on the atrial and mitral valves. And in these procedures, first of all, you see the range of codes. And there's a lot of these codes actually in this particular area from my perspective, and can be pretty complex with a lot of reading that you have to do. So, these codes are differentiated by what they are actually doing on the valve and how they are doing it. There is some extensive notation that appears before these codes that talks about the work that is involved. And here you'll see that when performed situation. So, when performed, percutaneous access and placed in the sheath, um, balloon aortic valvuloplasty, just closing it up. So prior to signing these codes, you got to read the notes, okay? The mitral valve is also known as the bicuspid valve. And there are, different types of procedures that you will see over in this area. All right, then notice, still talking about valves, but we have tricuspid and pulmonary valve procedures. And notice that the codes are organized based on that actual valve. And then once you get into the valve, what you're actually doing. All right, so let's look at a couple of these. So we have a CABG procedure. And CABG, not to be confused with the food, are types of grafts performed on the heart, completed using a vein, an artery, or a combination of a vein or an artery. So it is very important that you play great attention to the detail in this report that you're going to read for this type of service to identify artery, vein versus versus both. Also, during the procedure, the surgeon may harvest a vein for this procedure. And what you need to play close attention to is if the procurement of that vein was performed during an open approach or if it was using endoscopic technique. This is important because, let me go back. This is important because um, if it is open, it is included. If it is endoscopic, there is a code that is available. So when you go to look at these codes in the code manual, you will see that the first set of codes, 33510 to 33516, are for procedures where only the veins are used for bypass. So if they do artery and vein, you cannot use that first range of codes. Immediately after that, you have codes. Oh, and these codes are organized based on the number of veins that are used. Immediately after that, and this is why I say you need your CPT manual open. We have codes 33517 to 33530, which are reporting codes for bypass procedures using the vein and the artery. Of note, these are add-on codes. And what do you know about add-on codes? They cannot be used alone. So these codes are meant to be used with the next range of codes, 33533 to 33538. And these are codes for either arterial only or when you're trying to report arterial and venous. So let me just call out something that should be obvious, may not be obvious. If it's vein only, 33510 to 33516. If it's artery only, 33533 through 33536. If it's artery and vein, you drop the vein only codes and you use a code from 33533 through 33536 to report the artery only, and then use the add-on codes for the vein, and those are the ones that I just told you, 33517 to 33523. Now, if you're like, oh, I can't remember that, don't worry. It is written in the CPT manual multiple times. So again, if you, I said this a couple of times, this lecture is not enough because it is very abbreviated. You definitely need to get into the CPT manual, review the CPT manual language, in addition to, reading the textbook. All right. You have next up codes for anomalies, and these are procedures that are designed to correct a heart anomaly. An anomaly is an abnormality or a deviation from the normal structure. Okay. In this particular area, you have procedures for repairs, closures, shunting procedures, transections, and other complex procedures on the heart. These procedures involve the aorta, pulmonary arteries, septal, ventricular defects, and because of the complexity of this type of coding, you need all the documentation in front of you, right? And a dictionary too. Now, because of, again, the complexity of the anatomy, that's what makes it a little bit more challenging. Sometimes these operative notes can be pretty long. All right, heart and lung transplantation. So, what do you know about transplantation? There are three distinct parts of work. So you have the donor, you have the backbench work, and then you have the transplantation. All right, next up, we have extracorporeal membrane oxygenation or extracorporeal life support services. So there are times when a patient's heart and or lungs are not functioning correctly due to a sickness. Could be like from trauma. In those cases, they may make a decision to place the patient on ECMO, extracorporeal membrane oxygenation, or extracorporeal life support services, which allows the heart or lungs to rest and recover. So they abbreviate these as ECMO and ECLS. The code range, as you'll see in the manual, is differentiated by the initiation of the services, daily management, and other services that are components of the procedure. And then some of the codes are actually differentiated by the patient's age. And of course, you know I'm going to say this, there's a whole bunch of notes. There are extensive notes with this range of codes. All right, cardiac assist devices. Here, you're going to see procedures for insertions and removal of devices such as ventricular assist device, extracorporeal circulation, intra-aortic balloon assist devices. And these devices are designed to help the heart function properly. Of course, you got to read the operative note to find out the exact procedure that was done. And sometimes, so you have codes for insertion and removal, but there are also some codes for like repositioning the device as well. All right, so now we're moving on to vessels. Vessels are structures that move fluid throughout the body. And earlier, we talked about arteries and veins. So, arteries move oxygen rich blood from the heart to the rest of the body, except the pulmonary artery. And veins move the deoxygenated blood back to the heart, with the exception of the pulmonary artery. And arteries usually have one vein that accompanies them throughout the vascular system. And in the book, they got some really detailed pictures that show arterial circulation and venous circulation. All right, embolectomy and thrombectomy procedure. These are procedures that can be done on the artery or the vein. And the goal of these procedures is to remove a clot in the vessel. Code selection is made by the vessel as well as approach or the method of entry. And you see the words with and without catheter and direct or with a catheter. We're almost done. Venous reconstruction. So, venous reconstruction are, as the name implies, are designed to reconstruct the vein. The type of reconstruction is going to dictate what your code assignment is, and it could be a transposition, a graft, or anastomosis. And all I can say, there are so many subsection notes in this area. You just have to take it one step at a time. All right, endovascular repair of a triple A, abdominal aortic aneurysm, and or iliac arteries. So a aneurysm is an area in an artery that becomes weakened, which each with each pulse of blood through the artery, the weakened area balloons out or expands, causing more weakness of the vessel. And this type of coating actually has several components. And yes, I'm going to say it. There are lots of notes right before code 34701 that you need to read to understand. And one of the things that is discussed in this particular area is that if there is a fluoroscopic or radiological supervision that is provided, it's not coded separately. Remember, I said the code family will tell you in the situation of guidance if you need a code separate for the guidance or if it is performed. And this is a situation where you may see when performed used again. All right. You may need more than one code to capture the procedure. Terminology, anatomy, very important. In the documentation, you need to see the access or exposure route. And again, if you don't see it there, what do? You collaborate with your provider. All right. Additional repair codes that we have over here, direct repair of an aneurysm or excision, partial or total, and graft for insertion of an aneurysm. So these codes are divided based upon if it's a direct repair, if they're repairing a fistula, or they're repairing a blood vessel other than a fistula. Thromboendarterectomy. So thromboendarterectomy is a surgical incision that is made into an artery to remove a thrombus or plaque and arterial lining. This procedure can occur with or without a patch graft, and the codes in this range are differentiated according to the artery on which the procedure was performed. There are some add on codes over here, so you want to pay close attention to if that is in use. Angioscopy. This is a procedure where a fiber optic scope is used to visualize inside, watch this, of a non coronary vessel. This happens to be an add on code that is used in conjunction with the code for a therapeutic intervention. And what is therapeutic? Treating. So, one thing I will tell you about coding, repetition is key. All right, bypass graft, vein. So, these are codes that are organized according to the location of the vein graft anastomosis. So remember I talked about with the CABG procedure, how the um, harvesting or procurement of a vein for a bypass graft is included. However, if they do something other than the saphenous vein, that can be reported separately. This is noted in the subsection notes that are in front of the, what do you call them? In the CABG codes, that the note is there. All right, composite grafts. These are grafts that are made from donor and synthetic materials. These are some more add-on codes that are used in conjunction with other procedures. And a lot of times this is needed to capture the procedure accurately. All right, some additional code procedures, adjuvant techniques. These are more um, add-on codes. This is when the surgeon places a vein patch, placing a cuff at the distal arterial anastomosis site, or could be creating a fistula between an artery and vein during bypass surgery. These are done to improve the patency of the lower extremity autogenous or synthetic bypass graft. Then you also have arterial transposition procedures, something else to improve the blood flow here, improving the blood flow within the artery. And these codes are divided based upon if it is if arteries were anastomosed, another add-on code. And then lastly, here, excision, exploration, repair, and revision. These codes reports things like the patient has to return to the operating room more than one month after the surgery. and other services that could be performed. Um, Earlier, um, I mentioned that at the very beginning of the cardiovascular section, they talked about selective and non-selective catheterization. So these are this is a difficult section even for me. In fact, I stay away from it. But two terms you need to know. Non-selective placement means that the catheter is functioning in the vessel that is punctured and does not go anywhere else. Okay. Selective, it moves into one of the great vessels of off of the aorta, not including the one that is punctured. That's a simplified version of the description. There is I can't remember what appendix it is, but there is an appendix that shows you the different vessels of the heart. And for when you have the selective catheter placement. And these codes are essentially divided into five categories. Those five categories are actually listed in the subsection notes. So it's insertion, replacement, removal. Those are some examples. All right. So as it relates to venous devices that can be implanted, these devices are used for like intravenous medication or fluid delivery. And then your central venous access devices um, are classified if the tip of the catheter ends in the subclavian, brachiocephalic, superior or inferior vena cava, or the right atrium. And again, I'm trying to keep it simplified because there's so much more that you're going to see in the textbook. All right. Arterial codes are classified based upon if they do a puncture, a catheterization. They actually place a needle in there. And this first set of codes is for hemodialysis access. So when patients have problems with their kidney, these are codes to um, put in the to get the access for that area. But they also include codes for intravascular cannulation and shunt insertion. All right, we are almost done because I am getting fatigued. Number 4 out of 5. All right, dialysis circuit. These codes reflect a range of services that relate to the dialysis circuit procedure. In the CPT manual, you will want to review the definitions, and there are terms like dialysis circuit, peripheral dialysis segment, central dialysis segment, so forth and so on. And so over there, you will get to see more about that procedure. Also, we have procedures for portal decompression procedures. And we have, and that's codes 37140 to 37183. And you'll see it's things like venous anastomosis, insertion of shunts, revision of shunts. And these are all completed to manage venous pressures. All right. And then lastly, here you have transcatheter procedures. And transcatheter procedures are completed using a catheter to complete things like arterial mechanical thrombectomy, venous mechanical thrombectomy, putting drug into a vessel, and lots and lots and lots and lots and lots and lots of notes over there. All right, I promise we're almost done. Endovascular revascularization. These are procedures that are performed on the lower extremities because the patient has some type of occlusive disease. Over here, there are paragraphs that come before these codes to tell you that there's a whole bunch of stuff that is included in these codes. These codes are divided into 3 arterial vascular territories, and you'll see that reference in the CPT manual. All right, and intravascular ultrasound and endoscopic services. So here we're talking about a diagnostic or therapeutic procedure on a, watch this word, non-coronary artery or vein. And then we also have a surgical vascular endoscopic procedure where they are ligating the veins. This procedure is also known as SEPS, known as subfacial endoscopic perforator surgery. And the last area here, ligation. Ligation is the act of tying off, dividing, and stripping vessels. These codes are differentiated by the type of procedure, the site of the procedure. So if it's, a vein or an artery. Over there, you'll see codes like, when patients have like varicose veins, you'll see those types of codes over there. And we're at the end. We did all of this. I am done with part number 4. I'll come back with part 5, and then I'm going to get ready for the Super Bowl.